Good afternoon, everyone. Good afternoon. It is 3:30. We're going to begin our work session. We have a few board members that will be joining us momentarily, but we do have a quorum. Starting us off is discussion of the school mental health improvement plan. And I'm going to pass it over to Paul Coe, our Assistant Superintendent of Student Support Services, to introduce his team and share what they have. So.
Thank you, Chairman Haffey. So good afternoon, everyone, Superintendent Moore and board members. Today we're here to present an update of the School Mental Health Improvement Plan per North Carolina State Board of Education Policy SHLT 003. I'm joined by a few of our team members, Kendra Hill, Senior Director for Employee Relations, Cam Lopes, Director of Special Education Services, Social Behavior, Programming, and Extended Content, Mark Cowell, Senior Administrator for Crisis Prevention and Intervention, and Ray Marsh, School-Based Mental Health Coordinator. And so back in November of 2021, we provided an overview of our five-year school mental health improvement plan. And for today's presentation, we're going to be sharing an overview of this plan and its connection to our strategic plan. We're going to provide a quick overview of the requirements for our school mental health improvement plan as a refresher. And we're going to share an overview of our progress and our continued efforts in key areas of focus. And as the direction of our strategic plan has been set with our strategic priorities of our 4 C's, literacies, knowledge and skills, and behavioral health, we wanted to highlight that the work we are reviewing today is deeply connected to the behavioral health outcomes in our strategic plan. And as the strategic plan is a multi-year plan, we wanted to note that the work in our school mental health improvement plan is also a multi-year effort that we will continue to develop, progress monitor, and adjust to the needs of our students, families, staff, and schools. And we've shown this slide before, but we just wanted to share a reminder that behavioral health encompasses social emotional learning, behavior, and mental health. And of the elements of behavioral health, today's presentation will focus on mental health. We've noted in previous presentation that mental health is critical to children's success in school and life, and our work within mental health is about ensuring our students receive the supports to achieve academically while simultaneously supporting our students' sense of connectedness and well-being. And we want to reiterate with mental health that the work of mental health is not simply the absence of mental illness, but encompasses social, emotional, and behavioral health and an individual's ability to cope with life's challenges. And the next slide just reminds us that our behavioral health supports in our district are offered, like our academic programs, in a multi-tiered system of support at the school and district levels. Our continued work for all students through our school mental health improvement plan places an emphasis on those students who may face additional challenges. And in alignment with State Board Policy SHLT 003, we provide our mental health services through a tiered system of supports. And as a reminder, some of the key language in the State Board policy requires districts and public school units to adopt and implement a plan promoting student mental health and well-being, and for assessing and improving upon the effectiveness of these supports for both mental and social emotional health, along with substance use needs of students and staff. And the intention of the policy is to support students with the mental health component within our larger work of behavioral health, while further training staff to help identify when students may need more intensive mental health support, so that we are able to connect both students and families and staff with the appropriate community resources for outside assistance as needed. And so in terms of reporting to DPI, our plan was first submitted to the North Carolina Department of Public Instruction on September 15th, 2021. And subsequently, we will be submitting annual reports within the Healthy Active Children Progress Report / School Mental Health Policy in September of each year. And the School Mental Health Improvement Plan is required to be revised every 5 years from our first date of submission. And the next revised School Mental Health Improvement Plan is projected to be due in September 2026. And so this slide, the policy SHLT 003 encompasses 9 components in our school mental health improvement plan that you see here on the slide. And there are 6 areas of the plan components which are required with plan submission. And those are, again, as a reminder, universal prevention through core instruction, curriculum, and environment, early intervention for mental, social, emotional health and wellness, referral, treatment, and reentry, MOU with our local mental health agency, managed care organizations, suicide risk protocol, and stakeholder engagement. In today's presentation, we're going to be highlighting our progress and our continued focus in the areas of early intervention for mental, social, emotional health and wellness, referral, treatment, and reentry, stakeholder engagement, and our suicide risk protocol. And to share an update about our early intervention progress, I'll now pass it to Cam Lopes.
Good afternoon, Board. The district is meeting all of the requirements listed within the early intervention of mental, social, emotional health and the wellness component. A few examples of this work are annual review of the PSU's policies, procedures, and/or practices for crisis intervention. The exemplar practice that we have in place are the crisis plan reviewed and upgraded annually by the district crisis team. This also includes the human trafficking and sexual assault awareness training. Identification of strategies to avoid over-reliance on suspension or expulsion in the discipline of students with identified mental and social emotional health or substance abuse concerns. Our exemplar practice are the restorative practices, both circle and mediation, as well as the community resiliency model, or CRIM. Continued growth continues to be identification of strategies to avoid over-reliance on suspension or expulsion in the discipline of students with identified mental, social, emotional health, or substance abuse concerns. With our comprehensive plan for equitable discipline, this is the work that will continue to balance both the academic and behavioral health work in our district. Behavioral health serves as a foundation for achieving academic goals, while academic instruction also provides an opportunity for teaching and practicing behavioral health. These two are interdependent and cannot be taught in silos. It's imperative that we are ensuring that behavioral health is woven throughout academic instructional time to support and deepen learning. This work will continue, again, through the comprehensive plan for equitable discipline. The practice or program that we will have in development includes an expansion of restorative practices and the community resiliency model that will be tied to our behavioral health needs assessment, as well as the universal screener or BIMAS data.
So I'll now share an update about stakeholder engagement, referral, treatment, and reentry.
Right. Can we go actually to Ms. Sorry about that.
One of the areas that is a part of program development and growth here is with regard to our adult wellness pilot program that we are engaging in. We are establishing systems to provide wellness and mental health support to our employees. We have 2 contract positions that were developed to improve staff wellness, support mental health needs, and increase our employees' access to our EAP resources. The need for extra support became very clear to us during the COVID and during some of the stress times for our employees as we went through COVID. Our adult wellness coordinators are focused on providing resources, intervention, and crisis support. They are doing things like wellness circles. They plan to work on restorative practices as well with regard to our employees. They are doing outreach to our employees who are in need through different types of referrals. They are providing crisis response support when there is loss in our community or other concerns there. And we are working to help determine what needs our employees have so that we can identify and target our support to our employees so that we are going beyond what's in our EAP program to help provide more resources and to help provide more support to our employees as we move forward.
Now I'll discuss stakeholder engagement, referral, treatment, and reentry. In the referral, treatment, and reentry component, we are meeting all of the requirements. An example of this is strategies to improve access to school and community-based services for students and their families by establishing arrangements for students to have access to licensed mental health professionals at school. Our exemplar practice is supportive counseling from 2020. Our continued focus for growth includes Alliance mental health referrals and supportive counseling. Our practice or program and development includes this overview. Supportive counseling started when the pandemic began, and it was able to assist students with coping skills they typically received in person by student support services staff. Since the fall of 2020 and through May 2021, 576 students were served through supportive counseling. As we returned to in-person instruction, demand for these services declined. Alliance mental health referrals continue, and these are referrals to Alliance Health for school-based team coordination services, where we continue to offer support and guidance to students and families experiencing barriers to mental health treatment services. During the 2021-2022 school year, there were 268 referrals for this specialized service. And school-based mental health is our program where, through an agreement with WCPSS, community mental health agencies provide mental health therapy services to students at school during their normal day. School-based mental health is designed to remove barriers to mental health treatment and decrease the amount of interrupted instructional time. The update on school-based mental health includes Phase 1 being completed in June of 2022. Phase 2 is now currently underway. 12 additional schools and 3 additional mental health service providers were recently added to the pilot. And school-based mental health is now available at 40 schools, and 8 total mental health providers are serving WCPSS students and families. I will now turn it over to Mark Cowell to discuss suicide risk protocol.
Good afternoon, Board. So as far as the component that requires us to have the suicide risk referral, we have met that, and we will continue to meet that standard moving forward. One of the big areas we have is the staff awareness training, which allows us to train everybody in Wake County Public Schools. So whether it's maintenance workers, HR folks, all the people on staff at a school campus, everybody should be trained and be made aware of risk factors and warning signs when it comes to, especially when it comes to suicide awareness. And then the other part of that is when we do procedures and referral resources, again, our trained counselors and social workers and psychologists do not diagnose, but they do screenings and they do assessments. And so part of that assessment is through the Signs of Suicide program that we utilize. We use that for 7th grade students and 9th graders and 12th grade students moving forward. And so these are some things that we've had in place, and we'll continue to meet those standards. Areas that we focus on, who's sliding?
I think, yeah, they'll move it.
Okay, all right. The areas that we have for growth is the continued training for staff and administrators and families. We throw families in there because we have reached out to do parent nights for families, either at nighttime or sometimes on weekends. Virtually in COVID years, it was definitely done virtually. We've had that offered to schools. We did about 50 families last year were part of the presentation and trainings that we offered. And moving forward this year, we continue to offer those resources to schools to make that available for their family members as well. And also we focus on administrators to continue to make sure they're aware that they can train, do the trainings with us when it comes to suicide awareness and self-injury and self-harm awareness trainings. They can be a part of the CAS trainings that they have as well moving forward. And so those are all the areas that we continue to work on and move forward on. I think that's all I have.
Yeah. Thank you, everyone. Thank you, Mark. And so with that, we just wanted to reiterate that even though the standard says we have met, it doesn't mean that we have landed in a place and we don't have to do anything further, but it means that we have met the standard outlined by the policy. But the work that we have and the continued focus areas of growth are some of the things that we're going to be continued working on over the next 5 years until we have to revise this plan. So we wanted to reiterate that, and with that, we'll pause here and see if there's any discussion or questions from the board.
Thank you all very much. This is certainly a topic that is important for our students and staff, and I appreciate your commitment to this work, not just having met the standards, but knowing that it needs to continue so that we bring more awareness, not just to our school community, but beyond, on ways that we can help. Are there questions or comments from board members at this time? Ms. Cash?
So I do have some questions. First, one question. Presentation to families. Now, is that presentations that staff may recognize that there are students that have families that need to be aware of their students' feelings or what's going on? Or how do you make that available to the families?
And so it's offered to all schools, and anytime I do trainings, I offer to the schools, the students, the counselors who are there in the trainings. I always make sure they're aware, hey, if you want at elementary school level, middle school, or high school level, you can just do a parent night. And so sometimes they combine it with a PTA parent night, and just knowing, hey, we call it keeping your child emotionally and physically safe. And so it's one of those that they just offer it to anybody who wants to come, and I usually have it in the auditorium or the media center, depending on what space is needed. And so any parents who see that and want to learn more are welcome to come.
So what if there are students that have been identified by staff that are at risk? Do they reach out to families to come to this?
Well, I don't know if they reach out to them specifically to invite them to them. They can, but they definitely will be provided resources and support for their child to make sure they know how to get the help they may need.
Ms. Cash, oh, go ahead.
I was just going to say, I think what perhaps you're asking is if there is a student that is at risk and is screened, there is contact and interaction with the family about support and that referral process. This is an additional piece beyond that for schools that may request it to have it as an opportunity for their families.
Okay, so this is additional above and beyond what we try to do for at-risk students.
Yes, ma'am.
Yeah, and Ms. Cash, if you could, I don't know if I could jog your memory, but at the start of the pandemic, we saw a need for a lot of family wellness sessions just in general. So instead of just kind of waiting for problems to arise, we said proactively we'll set up family wellness sessions and even the restorative practices circles for people to just come together, not because there's a problem or an issue that arose, imminently, but more because folks were having a hard time in general. So we wanted to provide space both virtually and now in person for people to come together and share what concerns they may have and what resources are available.
Okay, very helpful. Thank you. I think I brought this up at one other presentation. I'm not sure which one, but in our emergency rooms, of course, we're seeing more and more young students coming into our emergency rooms with attempted suicide or distress of some sort. And I do know that they are then, if they don't go home with support, they go to some other agency. Some of those agencies are within our county, but I think we're overwhelmed in our county for beds for adolescents. And so a lot of them will actually go to outside the county and maybe outside the state. And I don't still understand, because I've kind of been looking for this, and I'm not an expert at this at all. So just from the outside looking in, I know Alliance has some contact with students that may go into Holly Hill or go into some of our local areas. But I'm still not seeing quite how a child that comes into an emergency room and is sent to another facility how we support them coming back into our school system, or how we make our teachers in our school system aware of that interaction in our emergency room.
So we do have a relationship, like we mentioned earlier, with Alliance, and so that is sometimes if we know ahead of time a child is going to be seen, we can wrap services around Alliance and have a case manager watch that. If we get information back, and whether it's through Alliance or not, we are teaching our counselors, psychologists, social workers, admin, to be able to reach back out to that student when they're coming back in, what plans need to be in place and implemented at the school level, and holistically looking at the child, what's best for that child. And so if there's therapy support provided or those additional resources, and like you mentioned, we are strapped, and when it comes to finding resources, and sometimes we have to go to Goldsboro or to Virginia, wherever it is, but we're just doing our best. And when they go to that level and they're needing to see to be in a bed like that, most of the time the lethality is so high that is the required safety protocol. And so what we are determining when we come back to us is we're just providing, again, family support for the student and the child the best we can to move forward to keep that child safe and have a healthy life.
So what is the contact from a local emergency room to the Wake County Public School if it is a Wake County Public School student?
That's where Alliance is often a liaison for us. And Ray, did you want to add anything?
I did. Alliance has a team that partners with the local emergency rooms, and when they are aware of a student transitioning back, they hopefully get consent, because nothing can happen if the parent does not sign that consent while the child is in an inpatient facility. But if they're able to get that consent, they can help with that transition to the school. So they know who to reach out to at the schools. They know which schools are in school-based mental health, for example, so they know that there's access to therapy that way. So there is an effort to do that. It is more challenging when it's outside of our local network or when parents do not consent to that communication.
So is it up to the emergency room in Wake County to contact Alliance Health?
That partnership is already in place. It's up to the emergency room to get the consent for Alliance, but that partnership is already in place at the crisis facilities.
Okay, other questions, comments? Ms. Carter?
Well, thank you for this update. And I too believe, I know often we hear, we're an education system, but like you've mentioned, and I know several have mentioned before, you can't get to education if there are other barriers. And this is a significant barrier for many, not only of our students, our families, but also staff. So thank you for the work. And I just wanted to follow up with that. I'm going a different route here, but I'd like some follow-up to ensure that that is being done on a consistent basis in our emergency rooms, because I've been told that that's not been the case. And I don't want to go into too many details, but, students transitioning back with not even a transition meeting, significant issues that quickly lead to more issues happening in another spiral. And so I would appreciate more follow-up to ensure that that is definitely happening. And if it's not happening, what we can do to ensure that that is a standard. If this is a Wake County student, that families coming in are approached about it, at least they have the right to say no. I understand that, but at least know that that's there. And kind of on that same route, I was wondering, I don't know if wondering's a word, but I'd also like to encourage more openness to looking at possibly, I know if this might cause, but BIPs for students with significant mental health issues, because I hear that a lot as well, and that there's some resistance there, and that could be again, I'm trying to be more proactive here to avoid additional spirals for students and families. If we were more proactive with some of those and putting specific things in place, and more communication with staff when students are coming back. So that's just a little, I'd appreciate that. And I did want to thank you for the work on the employee side. I know that Dear something E,
what do you, sorry.
Deer Oaks,
Yes,
our
I
employee
think,
system.
more staff members are aware now than they used to be of it because it's existed for quite some time. But I encourage more communication more often about that, but also about the student side of Alliance Health, because I heard from multiple families at the height of pandemic where there was months and months waiting for mental health services, and then Alliance, if it was depending on the situation, at times could work them in that same day if they needed that. So it is a great partnership, and I believe there are students and families and staff that need support all across our district with this, and I encourage, again, more frequent communication, because often you get that and then you forget about it, and but if it was more consistent from the county for families about the Alliance Health. I know it's on some of the websites, but sometimes you need it sent right to you. So thank you.
Yeah, thank you for those comments, Ms. Carter. If I may just add to what you were saying, I think that's part of our work, in terms of aligning all the systems, because we're not working as a school district in isolation. We have to work with our health partners, and we know that the system is often overwhelmed, but that's why we have this partnership, and we're going to continue to work through it. And just to note, we said this at a previous presentation back in last November, but there is a mental health collaborative that includes both parents and students, and we've had new students join on, and that's a group that Ray is a part of, and several team members, including special ed services and student support services. And so that's a group that's a core meeting space where we're trying to figure out how to continue to develop our services, evolve them, and expand them further. So just wanted to note that as well.
Thank you. We'll come over here. Ms. Kushner?
Thank you, Chairman Haffey, and thank you for the presentation and update. Because I do want to underscore the need to work with our county partners. I know that is a priority of our health department to focus on youth mental health, specifically suicide prevention, given this increases that we've seen in our community since 2017. I mean, I think, so I was glad to hear, Ms. Hill, that you're emphasizing the employee side as well, because I think it's just been a strain for so many in our system. And I do think the school system is a great place to make sure we have services available. So, so whenever we get presentations like this, I wonder about the scale. So I was glad to see the pilot is planning to expand. So what other strategies are we trying to use to expand CREM, to expand the restorative practices, and what can we as a board do to support that work?
Thanks, Ms. Kushner. So similar to the mental health collaborative, when it comes to restorative practices and CRIM and behavioral health overall, if you remember, we had a small team of 3 for restorative practices coordinators several years ago, but that team has expanded where we have representative instructional specialists across all 9 areas that work in partnership with both schools, but also our senior administrators to area superintendents to make sure that when schools want to have capacity building sessions around restorative practices circles, mediation, or even community resiliency model or other behavioral health supports, we have a team now that folks can reach out to then be able to set up these sessions, and folks go out to make sure that both capacity building, or at times when students need a mediation in lieu of other consequences that might look like out-of-school suspensions, we have a small team, but a team that's growing in the sense of how to do these facilitated mediations as well. So we are working on that, but we're not quite there yet, but we'll continue to keep at it until we get there.
Thank you. Dr. Martin?
To continue sort of the line of thinking on scale and really accessibility, I'm pleased to see the pilot program expanding. Just from a logistical perspective, when you say 8 mental health providers, is that 8 individuals or is that organizations?
Those are 8 mental health agencies, organizations, each of which provide a certain number of therapists for various schools.
So our 40 schools, that's about 20% of Wake County schools. So obviously we need to expand it. But even of those 40 schools, if I take 40 divided by 8, that's 5. So that'd be 5. If this were numerical, directly, it'd say 5 providers or 5 schools per 1 provider. But what I'm hearing is, and that's kind of what was my question, is are these 8 individuals or 8 groups? So how many people would be available to these 40 schools?
It's in terms of number of therapists.
And it might be that somebody's not there full-time, which is why we often talk about full-time equivalents. So maybe if we thought about it in terms of full-time equivalents, right? Because you could have 6 people each working 10% of the time. If we thought about it full-time equivalents, about what it would be?
So I can speak to last year's pilot because we're still unfolding phase 2. We're still onboarding the new agencies. Last year, there were 16 therapists. That equated to 328 sessions, 232 referrals, and that was among 28 schools. So the way the model is designed, each school has a therapist for one school day, starting off where they see as many students as they can in that day. As it grows and as therapist capacity grows with us, because that's been a challenge as well with the labor shortage, the therapist can come a second day and serve more students. So for each school, 6 to 10 students are getting therapy on site on average. Does that help?
Mm-hmm.
Okay.
If you were going to, what would be the ideal number? I mean, 6 to 10 students per school receiving therapy, and this is presumably on a weekly or monthly-ish basis?
Weekly.
A weekly kind of
sessions.
Session. 6 maybe is a reasonable number for our smallest elementary schools or some of like our early colleges. But if we're talking about our multi-thousand student high schools, that suggests to me that there's a lot that would not make it.
Right.
So what number should we have?
So this is the most intensive service we would offer within the school building. I can't give an exact number, but it is to help treat students with intensive needs, not rising to the level of crisis, but right below that. So it will be smaller scale.
Sure.
Our focus is getting to more schools so that it is an opportunity for more students. And the student support services teams within the school know their students and they identify who has the greatest needs and who would be referred. So with that, we're trying to serve who we can within that framework.
And
Well,
Dr.
this is where, from a board perspective, I'm just trying to think scaled, like Ms. Kushner was asking for, right? Because, well, we can't directly write checks. We have to advocate. And I think, your numbers were, I mean, even if we took the 16 therapists for 28 schools, we could scale that to our 197 schools. And if we could get to that stage, that maybe is a beginning number that we could, for example, take to the commissioners, take to the state, and try to make an argument for. So I think that's one thing that we can do from a board perspective is put the scale in context so we can advocate. I guess my second question related to the logistics is really accessibility. So I'm sensing that the students receiving this therapy are probably ones identified by counselors, principals, teachers, et cetera. Oftentimes, a family may have an inkling early, but oftentimes in crisis, you don't necessarily know how, who, when, why, what to contact. So what is the best avenue for families or even students who might themselves say, hey, I need help? What's the best point to reach out? And to some degree for students, we often say any trusted adult, and those trusted adults then can begin to, direct channels. But, how do we communicate to families, this is available, here's your point of contact?
I can take, yeah. So, Dr. Martin, I think part of it is, so we're kind of trying to bring back something that we used to have in place. I think we said back in 2012-ish, right? But as the pandemic increased, we're trying to bring back school-based services around mental health. So I think part of it is we have to work with the schools to make sure that there's communication and just general awareness, particularly through our counselors and social workers, school psychs, because it's sensitive situations that come up. So we have to note that these services are available, but they kind of come to a head through specific sessions. So it's almost more important that our student support services staff at the schools know how to connect individual students and families to these agencies. But I think at the same time, we have to raise a certain level of awareness over time, both through the schools and as a district to, I guess, build our capacity. But we don't want to get too far ahead of our capacity either, because we're still kind of in our infancy stages. Like you said, 40 schools is not 194 schools, right? But I think there's a process of both recruiting enough agencies who want to partner with us and do this work. And like Ray mentioned, when there's a labor shortage, people aren't jumping necessarily at the chance to do this work, over time, because there's a lot of logistics on their end that they would need to do to make it, I guess, sometimes economically worth their while doing a service for our students and families. So it's work that it's kind of more back in its infancy. It's our second year of instituting this pilot because we knew we needed to do something from the pandemic. And we heard from many folks that bringing these services to the school is really important. So we're trying to build capacity over time. But right now, to get to scale, Dr. Martin, I think, and if you're asking about advocacy, I think you all generally raising the level of awareness and letting folks know that there are services available at the schools that have this pilot. But similarly, if there are ways we can get more mental health services and agencies that are willing to partner with us, I think that would really help. But I think that's a conversation at the local and state level and maybe nationally that we have to be talking about.
Thank you. So again, I think the message to families is talk to your principal, talk to your counselor, talk to your teacher, trusted adult. The final thing I'll note is I would encourage us all to sort of move away from the pandemic-related language, because while the pandemic exacerbated a lot of things, most of what we're seeing with respect to mental health has little to nothing to do with the pandemic. It's just one of many factors that has layered on. Almost all of these issues were issues that we as a board were talking about and others were talking about, and we were seeing the cases in emergency rooms before the pandemic started. I think the pandemic is a convenient label that we use for a lot of things, but this is a much deeper issue than just the pandemic, and solving it is going to go long beyond, we hope, when the pandemic lasts. So I just think it'd be good for us to pretty much take pandemic out of our vocabulary when we're talking about mental health, because the issues are so much deeper and broader. Thank you.
Thank you.
Okay, Ms. Scott and then Ms. Waters.
Thank you. I hear what you're saying, Dr. Martin. Suicide rates had been on the rise since 2007. But I certainly do think that that pause opened a lot of folks' eyes to various crises that have been occurring and absolutely exacerbated many. But I was curious about what, related to what Ms. Cash and Ms. Carter were asking in terms of how we connect with our schools when emergency rooms have seen a student in crisis. And I was wondering if there are any policy, not necessarily policy from local, from Wake County Public Schools, but any like health-related, HIPAA-related sort of policies that are in place that also make that a little challenging to try to, in terms of health privacy, does that impede that connection, even though we recognize that's a needed connection that schools ideally would be aware that a student was seen in an emergency room having mental health crises. I was just curious.
Thanks for that question, Ms. Scott. I think a lot of the times it has to do with ensuring that parental consent or guardian consent is given. And it's the challenge of if that's not given, then services cannot be provided even though the student may have a need. So it's really important for us to do that. And I think similarly, it's important for us as a school system, along with our partners, to partner with our families to give them all the information so they can make the best decisions for themselves. But I think in terms of sharing of records or information, as long as the consent is there and all the proper forms are signed, then we are able to share information between agencies.
And so that understanding, of course, that that is the absolute worst time in a parent's life, that might be overwhelming to have that information presented to them to fully understand that. So I don't know if it's also a matter of being able to work with our partners in our emergency room or alliance to make sure that they have, maybe there's multiple times they reach out to the family to offer that, because I'm sure that initial moment would be overwhelming, and even processing what had occurred. Something I just want to toss out there is I don't know what appetite there is for, in terms of general mental health awareness in our local community, but doing a little bit more to partner with local councils of churches who can also provide, optional groups for folks. Religion aside, I know that many clergy are able to help people process through thoughts. I certainly respect separation of church and state, but I think there is a sense of community where we see churches doing outreach to people who are not necessarily members of their church. We see that often. And then the last sort of question I had was the opportunity for telehealth, mental health visits at schools, where we might be able to even work with therapists who are not, and social workers who are not necessarily local. I know in some ways that was like the silver lining out of the pandemic, was the opportunity for mental telehealth visits for folks who may have not necessarily felt comfortable going in, and even like the texting for people who might have hearing impaired barriers, but just wondered if that is something that could also increase the number of sessions that our students could have who are at that point.
Yeah, thank you, Ms. Scott, for those suggestions. So the telehealth piece is something I think there's some legal parameters we'll have to continue exploring, and we have done so, but we're still looking into what is legally providable, right? And so we'll look into that, and when we have more information, bring that back. And to your suggestion about, are there ways we can partner with community organizations or even churches? That's something we can also look into to just raise the general awareness that hopefully, I can't speak for everybody, but we know that there sometimes is a stigma with mental health that you're only supposed to seek help when you are at your breaking point or the bucket's, spilling out. But what we're trying to espouse is that mental health is not about waiting until that moment, but it's actually a practice we can engage with our students and staff and families regularly so that the bucket doesn't overfill, right? And so I think there's some of that we have to message continually, just maybe as a society. Yeah.
Ms. Waters.
Well, thank you for this presentation. I value learning about your work, and Mr. Coe, you brought up what I was going to ask about the stigma, because there are certain groups that are less comfortable traditionally seeking behavioral health support. And so in participation in a lot of the resources that you have, to the mental health collaborative, to the parent work sessions, are you seeing participation that is reflective of our school communities? Are you seeing parts of our student body that are not accessing the resources based on different social groups?
So yes, to answer your question, with the student population that's represented on the collaborative, there is diversity of race and ethnicity, so that's really good as well. I can't speak to the parent events. I don't know if Mark would like to answer that part.
It's been a diverse crowd as well, and so moving forward, hopefully it continues to be diverse.
Okay, and then I had one question about the adult wellness. So how quickly can someone, an adult who needs the support, be engaged with a counselor or receive the support that they're needing?
So it is a program that we're just beginning, that we're kind of standing up, and we are working on those processes for how individuals access and request assistance. But they are pretty responsive. They are responding to crises. They are responding to individual needs that we are hearing, where they are reaching out to employees if there are concerns. So we don't yet have, but we're in the midst of working on what sort of referral or request documents may be available to our employees, but they are working to be really responsive to try to provide services. And they are both clinically trained. They are clinicians, both of them. So they are able to help, and they are also working to identify community resources as well, similar to what's happening with the students, so that when we have an employee who has a concern about a particular type of issue, they already have the support, the relationships established with those community-based resources so that we can direct employees there. They are also working to expand knowledge and information about our employee assistance program. So again, depending upon what our employees are seeking or needing, that we can direct them to those services as well. So as I said, we're just kind of getting started and moving with it in terms of the resources there, but I feel very encouraged in terms of what has already happened and what they've already been able to do in terms of reaching out and trying to provide assistance to our employees. So I think it will be a good, responsive service for them.
Thank you.
Thank you. Ms. Johnson-Hustler.
Thank you. A follow-up to, well, actually, this is a question that's probably relevant for both you, for our educators, but also our students. So given and let me say first, thank you. I think I must have screamed during COVID that our teachers needed support and was trying to figure out were there EAP options. So I'm certainly glad to hear we're standing this up after literally begging for support and respite for our teachers. And I think now more than ever, we all need it because, the long-term impact of COVID is still resonating for our educators, for our students reintegrating themselves back into the building completely and back into, as my 16-year-old says, they outside. So it is very different. I mean, they are literally now just embracing that being outside literally just means we are fully back in the world, and they've spent the last 2.5 years, 1 foot in, 1 foot out. So thank you for standing that up. And so my question is more about scale for both of these. There is no way that I have any expectation or hallucination that you'd be at scale at this point, given the need. But I am curious about, have you all talked about crisis management? Because, again, there are going to be places where the need is greater. So if a student is being released from an emergency department, or actually even if they've been in care and they are coming back to the school, or if there has been known suicide ideations or attempts, or if educators have taken a long leave of absence for their own mental health and reintegrating back. So those are things that come to mind, one, that I'm having in my emails, thinking through how do we create, I don't usually like tiering things, but I do believe until we're remotely kind of touching scale, that we should be thinking about a way to kind of prioritize care. And that's my opinion, maybe not the board's.
I will speak as to the, from the employee staff side of it. We have actually talked about a tiered system where we are providing at our basic level, our tier 1 level, resources and information support at a very broad level, that our next level would be more intervention, such as, there are things going on, maybe a loss at the school, other things like that, where we're providing those sorts of things. And then our highest tier deals with the crisis situation, and that really is where a lot of this was born, because we were getting those phone calls, we were getting those concerns about employees in crisis. And so it was a big reason that we really pushed for this, is to help with the crisis as well. So yes, that is exactly what we are looking at, is broad-based support, information, EAP resources, what can we do, what can we provide at that level. Then when there are concerns, how do we step in to help with concerns, provide some sort of intervention at those levels, and then looking at crisis response as well.
And Ms. Johnson-Hustler, from, I guess, the student-facing lens, I think we do have a tiered approach, like we said at the top of the presentation, that having a multi-tiered system of supports is really important for the umbrella of behavioral health, right? So that what happens every day, there's proactive stances on behavior, SEL, and mental health, so that it's not, again, not when a student's at a breaking point that then we jump in, but there's an everyday thing going on. Similar to what we're saying in the behavioral health strategic priority, that we're focusing on the well-being, empathy, respect, and work ethic and habits. So I think it's about doing that work, but then how can we continue to resource and scale the supplemental and intensive needs that we know keep coming up? And, again, Dr. Martin, I'm not trying to disrespect your comment about the pandemic, but the pandemic did exacerbate and increase the need. And so that's where things like supplemental supportive counseling or community liaisons came in when we were not in session, and then why we decided to go back to the school-based mental health pilot is that in the mental health collaborative, we said we need to have school-based services. So we are working on that end, and I think it's doing both the core, supplemental, and intensive all at the same time. And so we're a little bit, building the plane as we're flying it because we have to.
I totally get that. And respect it. I just want to put my 2 cents in that I especially, and Mr. Coe, I have one school that I'm like, hey, I need you to put a ton of resources here now, today. But I also understand there are fundamental needs across the district that have to be in place. So for me, I think a priority personally for me as one board member to say, I'd like to see us have a process very similarly that Ms. Hill just spoke to, because it's very similar, right? Like if we have a crisis at one school, that you deploy your crisis team to provide support. What I'm saying is I think that's going to be important now when we see more than one or two schools have one or two students at a school literally at a breaking point. And I agree, I wish we were getting to them before then, but we're not, right? Like when we're hearing due process, inevitably, and I can only speak to the nighttime panel, we always say, hey, why didn't we intervene 2 years ago when we started to see these behaviors? And your staff and office doesn't see this until essentially probably just a little bit before we do. So I'm trying to think about, given the resources we have today, what do we do knowing that they are not where they should be, so that we're not in these due process hearings being able to completely pinpoint where we should have been intervening. And by we, it should be everyone, not just the school, but I can only speak for the only place I'm seeing it personally show up is in my role as a school board member, that we can kind of, I see Ms. Carter, who serves on the nighttime panel with me, and I'm like, yeah, we probably got like 5 cases in our head that we could have said, this is a great intervention point. So I certainly know I'm asked, every time you are before me, Mr. Coe, I always have a list of things. And I'm going to stop because I have a longer list, but as always, I could just email you all of the things that I'd like to see us do. And I do appreciate the work that you are doing with very little resources, because I get we don't have what we need to meet the needs of our students, but it is still important to express, okay, then how do we use what we have to be most efficient with the resources until we really build ourselves out? And I agree, we are literally flying the plane while we build it. So I get it and appreciate it. But I'll send you the rest.
All right, and Ms. Kushner, you had a follow-up?
Yes, thank you. And I just wanted to add, we have to make it a statement publicly that the Leandro decision would be funding. I have to stay on message. 900 more nurses, counselors, psychologists, and social workers for our schools. What could you do with 900 additional people? Because I think our gaggle pilot showed, we went into that pilot with eyes wide open, trying to do what we could with using technology. And that gaggle showed us you can't do it with technology. You can't do it with trying to do things through algorithms. We need people in our schools. We need adults in the building to support our other adults and to support our students. And the last 2.5 years have shown us the need. And this community, this state needs to step up and serve our kids and our adults. And it's not doing it from the Jones Street. And it's maddening to me.
Ms. Kushner, you hit my question that I had, is what are we hearing from DPI in regards to advocacy for more funding for these positions, given the need that we know we have, if anything, statewide? Yes.
Yeah, the thing that we've heard is with the what do you call it? I think they call it the ARP funds, but it has transitioned into the ESSER funds, and so part of us opting into the testing program that now is at-home testing. There are some mental health services provided, but it doesn't come in the form of people that Ms. Kushner is describing. Is a state-sponsored program that it's similar to what we are doing, with our school-based mental health work. So it's not a necessarily value add-on per se, but I think a combination of that plus more people is always going to be helpful. So advocacy on that front, I think, would definitely help our cause.
All right. Well, I'm going to stand on my soapbox for a second and just say that our legislature is in charge of funding those positions and funding those dollars in the school. And Ms. Marsh, I appreciate your explanation of the tiers that we're doing. If we find a student who's not at that just below crisis level where we need to see them in the school, what's our referral process for them to see a provider outside of the school?
And do you mean if they are at the point of crisis, or at
If
what
we
point?
just notice that they need additional help than what we're able to provide with our school counselor and our resources at the school, but they're not at the point where they can be seen at the school. I'm sure as we're tiering, there are students that need referrals to outside help.
That goes through the Alliance referral process.
Okay.
Right.
All right. Thank you. And I want to thank you all, Ms. Marsh, Mr. Cowell, Ms. Lopes, Ms. Hill, Mr. Coe. This is a heavy lift, an important lift, an emotional lift, and a needed one. And your efforts on this is we appreciate you being here and answering our questions. We know they weren't all specific to the plan, but what we're seeing in our schools and making yourselves available for this. And we certainly want to thank Alliance, our partners, and Wake County for their understanding that this is a need in our schools and for our students. And I would be remiss if I did not let folks know that if they're in crisis and need to talk to somebody, to please dial 988 and reach out. And I believe the last number I heard is we have a 450 bed shortage in Wake County for mental health needs. So it's not just our students, it's countywide, and thank you all. Superintendent Moore, anything else you want to add?
I'll just add that it's a 5-year plan, but we're committing to bringing those updates more regularly to the board so that we can continue to demonstrate progress and understand priorities, make changes if we need to internally, because we really don't have to do it for every 5 years, but we want to keep it front and center.
All right, thank you. And we're going to shift gears to a discussion that began prior to the pandemic, talking about a ombuds position. And so we're going to discuss the potential for this position in our school system. And no decision is being made. Our decisions are made at the school board level. We're joined by Dr. Robinson, but I'm going to hand it over to Superintendent Moore.
Thank you, Chairman Haffey. As you said, we had some passing discussions about this in 1920, and we're just about at the point where we were going to bring some information to the board to discuss and review. So we're doing that today. I've asked Dr. Robinson to join us so that he can make sure that he's capturing anything as we're talking and discussing and that sort of thing as we move forward. Our intent for today really is to discuss the potential need for a position like this in the district, determine yes, no, we want to move forward with it, and second, to get some feedback from the board based on some of the job descriptions that were attached to Assembly for your review on what the priorities would be for a position like this for the district, so that staff can then work on a job description if we decide to move forward to bring that back to the board as next steps. I've asked Jonathan to join me as well on this because he was a part of conversations with our former chief of staff and I think Jackie Ellis. They were all kind of working on descriptions and possibilities and what this looked like. So I attached a number of things to today's item that just gave you an idea of what this looks like in some other districts across the U.S. And some of them were actual job descriptions. I think like Fairfax and maybe Guilford are actual job descriptions. And then some of them were more like public-facing web pages. The DC Public Schools and the Pasadena Unified School District, I believe, were sort of public-facing documents that parents or community members might see when they go on a school system website, so that you could see how that, the front-facing part of that would be as well. So I would love to hear feedback from the board on what you think about an ombuds position for the district. I can tell you where I started from when I first thought of this. We're a very large district. We have a lot of staff, a lot of departments. We have policies, procedures, and I think that it is incumbent upon us as a district to find ways to ensure that we connect our families and our community members and our staff members, our students, to the places where they can get their questions answered and their problems solved. And sometimes that can be difficult to do if you're not sure how to access the correct person in the district or ask the right question of that right person in the district. And so, what I thought about when I thought about the ombuds position was a person who could be a first point of contact. We want the schools to continue to be first point of contacts for issues that are at the school level, but sometimes parents don't know where to go after they're at the school level, and that gets sort of tripped up in policies and procedures and a lot of formal types of ways to address issues. So I think an ombuds position, well communicated and well put out there in the community, could be someone that could connect families to resources, processes, perhaps provide an interpretation of what a policy means and what a process should look like, to ensure that our families, our parents, our students, even staff, like I said, have access to good information to help them move forward with their question or concern. So that was sort of the main thinking that I had. I've had a lot of other stuff that has sort of rolled around as I looked at different job descriptions for folks, but I want to, if we're going to move forward with this, I think it's incumbent that we, as a board and superintendent, develop that collaboratively moving forward, so that we have a good understanding of what the role is and what it's intended to accomplish, review the job description as it comes forward, determine some things around reporting strategy and all of those kinds of things. So that's the work that is before us. And I didn't know if Jonathan had anything else to add.
As systems entities become larger and more complex.
Is your microphone on, Mr. Blumberg?
A term that's used more frequently as a navigator, just helping people be able to access in a user-friendly way a fairly complex system. You have very good policies, and your policies, though, they're complex by nature, and that's just because there's so many different laws that apply. You have anti-discrimination laws, you have laws for special ed students, you have grievances, you have Title IX issues, you have petitions to remove records, and they're all dictated by statutes, dictated by policies, and so you can't put them in just one basket and say this is an easy way to do it. So the idea of having somebody that can help individuals know where the right place to be if it's not resolved at the school level makes a lot of sense. And in my past conversations with staff about it, that was part of the topic, and just amplifying on what your superintendent said. The other is that, a couple others is just the notion that sometimes the disputes become ongoing and lead to sort of different tensions and conflicts. And so if this position with the board and superintendent's interest could also be somebody that's there to explore informal resolutions, mediated resolutions, so that parties can move forward in a positive way, that's another possible asset, advantage of such a position, so that not so many of these cases have to result in a you win or you lose. And so those are just some of the thoughts behind it. There can be some training components where an individual like this could help provide training for staff on best ways to implement the policies to be supportive and positive in the face of some conflict and dispute. I think that those are some additional areas. And then also, at the end of a dispute where it's been resolved in one way or another, and either the school has had to put in place new measures or the like, helping implement change from the outcome of so that the district, as a part of continuous improvement, learns from it. And so those are just some ideas around it, and appreciate the opportunity to weigh in.
All right, and we certainly appreciate Superintendent Moore, you bringing this to us for feedback, as we know ultimately the hiring of this person is at your discretion, but board members, we'll open it to questions, comments. Ms. Cash.
So, Ms. Johnson-Hostler and I have wanted this position for a very, very long time from the very beginning. And I know all of you have, so I'm not just, I actually liked what the Pasadena piece said. And I don't want to bog this position down or complicate this position, because I think it can be a very simple position that either reports directly to the board or to the superintendent, but not under anybody else, because it is kind of the one, like a press secretary, that I used to think I always felt like the press secretary, but I just want it to be not a complicated position, because it is the person that somebody in every field, everywhere, can talk to. And it works well in corporations, it works well in non-private sectors and nonprofits, but so I'm excited about this, extremely excited about this, so I would like it to definitely report directly to the superintendent.
Okay. Other folks, Dr. Martin?
I, too, am very much in favor of this kind of position. I think it can be extremely important. I worked very hard with others to create this at NC State, and several years ago we did finally get a ombudsperson there, and I think it's a very, very valuable position. I think it's really important that the nature of the position is communicated well, because a lot of people don't understand what an ombuds can or can't do. I, too, like the Pasadena one. I mean, looking through all of these, a lot of the job descriptions felt a little bit like it was sort of the kitchen sink got thrown in the job description, and I would encourage us not to do that. Trying to keep it a little more streamlined, a little more focused, I think adds to a professionalism, but also communicates more effectively. I think I would like to make sure that whoever the person is would become a member of the Professional Ombuds Association, the International Ombuds Association. I just, again, we want to keep this as professional as possible. I actually like what Pasadena did, and they have it, the position reports to both the superintendent and the Board of Education. I think that is critical, because you don't want it to report to either one, right? The board can be political. Fortunately, we're not an overly political board, but it can be perceived that way. But the superintendent, it can be perceived as, well, you're the head of the organization. If the ombuds just reports to you, and I've got a problem with the organization, then is the purpose of the ombuds just to protect the superintendent? We don't want to do that. And I think the best pairing of that is to report to both the superintendent and the board. I mean, right now the board only has one employee, and that is the superintendent. And I think this might shift it to the board having two employees. I just think there'd be a lot of wisdom to that. It gives a little bit more distance from the organization, and I think can provide a little bit more of a healthy framework for dealing with stuff. I think we need to give a lot of thought to location for where this person would be. That's something we talked a lot about at NC State, and ended up renting an off-campus space for the person to have an office, because there was concern, at least at NC State. The ombuds was primarily, in that case, for faculty and staff. But there are times where you really do need anonymous reporting. And so if it was in the chancellor's building, or somewhere else, or even the faculty senate building, right, then you're going to the appointment. So think about that. I don't think it would necessarily need to be an off-campus office, but the person, I think, would need to there would need to be a mechanism to meet in an anonymous location. So, whether the formal office would be separate or whether there would just be a space to meet separate, but location, I think, is something that's critical. In terms of communicating to people, the role of an ombuds, which I think is really, really important, because the ombuds can't do everything. I think a lot of the language in the various documents was very good, right? The ombuds has to be a neutral party, can't be an advocate for or against. At the same time, when a person is walking through an issue, oftentimes they need an advocate or an assistant. So I might suggest, in parallel to thinking about an ombuds position, could we create an advocate or assistant team? And that team could be parent volunteers, other staff, other teachers who could be called on to just walk beside a person who, I mean, this wouldn't be in all cases. I think the ombuds could just, sometimes it's just a call, hey, who do I contact for this? That's easy. But some of the more complex issues where you really do need some of that assistance, you kind of need, the ombuds can't be the advocate, but the person can't just be in isolation. It can be a very isolating situation. And so if we build a cadre, and I would recommend that it be a trained cadre, right? Have people sort of, to be an assistant, you'd have to go through some level of training, familiarity with how to navigate our policy manual, with, familiarity with the chain of command in the school system. I don't know exactly what it would be, but I would love to see some kind of a training where parent volunteers, staff volunteers could basically be available, not required, but the ombuds could then say, look, I hear your issue. These are the policies. Let me put you in touch with, and then that could be a person that could walk alongside of it. I think you did something like that in parallel. Could be incredibly valuable. The other thing that I think is also in parallel to this is this position would be, there'd be value if we also could couple it with mediation services or a mediator. Because right now, our chain of command is fairly formal. It's principal, area superintendents, various other staff, superintendent. And right now, when you go about mediation, who is the mediator? More often than not, it's the principal, the area superintendent, right? It's the area superintendent, it's the person in the principal. We don't have sort of that independent mediator position. Again, the ombuds person needs to be skilled in mediation, but the ombuds can't be a mediator. So how we would tie that together, I don't know. But I think putting all these pieces together is what's going to really take us to that stronger, more healthy position. But really like the work, lots of great ideas. Would love to see it come into fruition. And like I said, I think the Pasadena document sort of hits a lot of that really good balance.
Ms. Johnson-Hostler?
Not much I'll add. You heard Ms. Cash say we both are extremely excited to see this here, and I do agree. I don't want it to see it be a kitchen sink. I really see this as the place where so many of our parent advocates become parent advocates for other families because they get lost in the system because it, as Jonathan said, Mr. Bloomberg said, it's a lot of laws, it's a lot of policies, and so it is very easy for people to get lost in that structure. I had not thought about what you just said around a team of people, but I was trying to go through my emails. A community advocate shared a very similar structure. I think it was Chicago. It was a very large city. So I'm going to go through my emails because I remember who sent it to me, that actually had a structure of trained advocates who supported the school district in not mediation, but just making sure people got to the right people and they understood some of the most commonly or frequently asked questions, so that that information is being shared consistently and the language is tight and the same no matter who is using it. So I'm going to look through to see. I know it was a large district, but I can't remember off the top of my head which one it was. So I do think that's a great idea that I didn't think of until you just noted it. So thanks for adding that. I think for me, this is going to be especially, one, we're in the middle of long-term changing all of our policies, so it'll be a great way to help people know that we've made tweaks to a policy or we have a brand new policy that didn't exist before. I know you are tired of me saying not everyone spends their time reading our policies like we assume they do, so they don't know sometimes that things are actually a policy until they need it. Most people don't look at policies until it impacts them personally. So this creates space where that is someone who provides that. And the other thing is, Ms. Cash related to other entities, a lot of state government also already have ombudsmen. So there are a lot of our colleagues who can share kind of how this works in similar situated state government right here in North Carolina who use them. And I'm sure they can tell us some lessons learned. As it sounds like you probably can too, Dr. Martin, for creating this at NC State, because I do think it's, it's a little hard to juggle so people are clear, including the people, us, that this isn't an advocate for one side or the other. And I think that will probably be the biggest messaging that we will have to stay on. And again, I do agree that they should certainly report to the superintendent, largely because if people are coming to us at that level, they want to know it's getting to the superintendent and not getting lost in the hierarchy, which is why they can't figure out our system anyway. So a lot more work I get for the superintendent. I think I've already shared this with the superintendent, but I do believe it goes to, and some of you have already heard me say this, it became crystal clear to me in a couple of community conversations that we are at a very different place. I grew up in a time where people trusted the school system, no matter what school system it was. That's not the case now. And so I also see this as an olive branch to rebuilding the trust in our district, that we do have someone dedicated to hearing what the concerns are and will adequately relay them to the district, to someone who actually can implement change. And right now, I don't know that our community, any community, knows who that is. It's at the board. How do they get to the superintendent? And so I also think that person can make very clear of how decisions are made. My favorite funny one is school board doesn't decide lunch menu. But we know that there are far more heavier questions that people don't always know who is the decision maker and how did that policy or process get in place. And so I think that for me are key message points that I think will be ideal for us to share as board members to the community as we develop this position.
Okay. Further comments? I think for me, ultimately, the job description is, what we want this to grow. We've heard, potential to grow it into more of an office with a team so that we can reach more parents. So making sure that that person can not just manage the scale of this large district, but if there ends up being further positions in that position, seeing where that office can grow to if need be. And I think really, for me, the clarity is making sure our public knows what the office is. And I agree that Pasadena document really clearly states what an ombuds position does and does not do, so that people who are going to access that office know what they're going to get when they reach out, because many of our families want to advocate for, to use Ms. Johnson-Hostler's metaphor, pizza rolls versus cheese pizza. And we know that it's heavier than that. But I think that clarity to our public is probably the biggest piece for me, is making sure that we're able to not just have that position in place, but let parents and folks know that it exists and that it's there for them, and clearly in what capacity it is there for them. Are there any further questions before we adjourn?
Well,
Dr. Martin, Dr. Robinson, then I'll hand it back to Superintendent Moore.
I'd like to make just a little bit of clarification. I think Ms. Johnson-Hostler's comments were absolutely right, that people often want to know, how do I get information to the superintendent? At the same time, I think it's absolutely important to make clear that the ombuds does not report on cases to the superintendent or anybody else. Anything reported to the ombuds person is confidential. A good ombuds person does not even keep notes of the meeting, because that would establish a record. So the ombuds person is there to listen And generally, it's wise for the ombudsperson to meet periodically with the superintendent, and I would recommend also the board, to say, look, we're used to disaggregating data and information, right? I don't have to let you know who, where, what school it was or anything, but if I'm seeing a pattern of issues arise, that's where, as an ombudsperson, I would want to meet with the superintendent and the board and say, hey, I can't tell you specifics because that's not what ombudspeople do, but I'm seeing a pattern of this type of bullying, harassment. I'm seeing a pattern of this kind of whatever it is falling through the cracks. So I just think it's really important to note that the reporting structure is not about the details or the specifics. It must be anonymous. The ombudsperson never, unless it's dealing with a reportable issue like child abuse or something like that, the ombudsperson never reveals the person. That's, they can direct you to say, here is who you can talk to, but at the same time, it's also valuable for that ombudsperson to give the more general report to the board, the superintendent, et cetera.
Sorry, apparently I should have used pattern versus frequently asked questions or reporting.
No, important language, but I think the public will be listening to this, and I think a lot of what we're going to need to do is communicate what is an ombudsperson, what's their role, how do they work. So, thank you.
Dr. Robinson.
Thank you, Chairman Haffey. So I have a quick question. There were several comments that were made, and just from our understanding, was there any other information captured in any other job descriptions that you feel as though should be captured or we should tease out or utilize as we look at the one from Pasadena?
I mean, I'll say for myself, I think the description and general job statement that Guilford has, I think is a really well done description of what we might be looking for. I think Fairfax does a similar thing, but they kind of list it out numerically, and I didn't really want to speak to the job description because I know we have our own format of job descriptions in Wake and what they look for. So I didn't feel like dictating specifically what the job description was, but those are the two things that I appreciated from things. Ms. Cash.
Well, and I do think we need to be careful about requirements for hiring, because I don't think it takes a lot of the things that were in some of these job descriptions that need to be a requirement for hiring, like a master's in something and things like that. We need to be a little more open-minded about that. This is a conduit of trust with our community, and I do know in Guilford they did say something about a key conduit between the community, parents, and students and the district office. That's important, but when you get a little bit deeper into most of the job descriptions, there was very specific duties, and I just think that bogs us down. I just want us to be careful on looking at requirements for this position, because it doesn't take a master's in anything, I feel, to be a good spokesman for this community and or be a good trustworthy person to talk to the community. So I saw a lot of that in these job descriptions, so I kind of like zoned out on that.
Well, I think in a lot of our job descriptions, we ask for a master's in education, and that can sometimes bog parents down in the edge-of-speak and buzzwords that we like to use. I don't think it's a requirement. They obviously need to be able to understand what the district is saying, but they need to be able to relay information to parents in a way that is more plain language than what we necessarily use as a district. Superintendent Moore?
So what I was going to say is because the Pasadena is not really a job description, right? It's a community forward-facing type of document that's very clear and explicit on the role, which I think they did a very good job communicating. The Guilford, the Fairfax, some of the others are actual job descriptions. So I think what I'd like to ask the board to do is just provide any feedback on anything that you see perhaps in a job description that's either missing in the Pasadena or just feedback back and forth on any of those. Anything that you can send to myself and Clinton, and if you wouldn't mind copying Jonathan as well. well. And when we create in Wake County a job description, we do a minimum qualifications and a preferred qualifications. And so I think that may be something that we take a look at here, where there may be more how we set the minimum versus what we set as preferred. And really, there's language that's used in a lot of these job descriptions about or equivalent experience in. So I think that there's a place for that as well as we seek that moving forward. This can be called, the name of this position can be called a lot of things. I am probably going to want to stick with just ombuds, not ombudsman anymore. Ombudsperson is just too long. So I'm probably sticking just with ombuds. But if you have any other thoughts about a different type of title, that would be great. I think while it may be confusing to some people or they may not have general knowledge of what it is, I think it is becoming more commonplace. And therefore, and we'll need to do a good job, obviously, communicating, as all of you have said. So, but our next steps will be to take the feedback from today, anything that you guys might send me via email or talk to me or Clinton about, and come back to you with some type of preliminary draft job description so that you guys can take a look at it, and we'll go from there.
All right. Thank you, Superintendent Moore, and thank you, board members. With that, we are adjourned, and we'll come back at 5:30 for our regular board meeting. Thank you.